is normal. In children, over 12 infections with colds a year is normal. But they are very much what they say they are. It's a head cold. It's above the neck. It's a sore throat. It's a runny nose. It's excessive sneezing, itching eyes. That's your head cold. The crossover comes with complications. A head cold can turn into bronchitis. It can turn into a full-blown sinus infection if left unattended. The difference between that and a flu is a flu hits you much harder, much earlier, and affects your whole body. It goes through the muscular system. It makes your bones ache. Mm-hmm. It makes the muscles stiff. You start getting spasms throughout the body, and you're a lot more unable to complete your day at work. Mm-hmm. That's the difference of the flu. And flu viruses adapt very quickly, especially the human flu. It's one of the fastest adapting or evolving or mutating viruses. It changes every year.
Yeah.
It becomes something else as we are exposed to it. And flu viruses need us to survive. So this time of the year, they get into us because our behavior changes and we start picking up more and more infections. And around people that spread the infections, that much more.
Yeah.
So flu viruses mutate, and we get the special group of swine and bird flu, which is very active this year, especially swine flu, which is much more severe infection from the outset, and it goes straight into the chest.
Yeah.
So we very much need them, but we also very much need to look after ourselves when we get them. Rest, listen to your body. And if you listen carefully, you'll know if you need extra help, if you need to see a physician or speak to someone. If you start hearing your breath sounds, if you hear yourself breathing when you're quiet at night, if you know your body and you know that fever is going on too long, by day 2, you need additional help. The young and the old, the very young and the old are the groups that we watch the most, and we treat them early because the complications are that much more severe. And also, if you've had a very bad chest infection or a bronchitis pneumonia in the last 6 months, I'd recommend you get help on the outset, immediately, so to prevent it recurring.
Yeah, because, you know, it's correct what you're saying. There is that moment when you know, oh, I need to get to a doctor now. It's not going to get any better.
That's it.
Ben, hy nou gaan vir ons musiek maak en dan vertel Dr Leon Strauss, 'n homeopaat, vir ons hoe om griep en verkoue infeksies te voorkom. En ons Ben hy nou hier op SFM, ons gesels met Dr Leon Strauss, hy's 'n homeopaat en ons onderwerp vandag is griep en verkoues. So Leon, how can you prevent getting cold and flu infections? You've explained now the difference between the two, but and you said that we need them in a way, but we'd like to prevent them.
Bad news, there's no avoidance. The good news is this way is to delay the onset and to decrease the severity. With most infections like viruses and bacteria, the severity of the infection is determined by the amount of bacterial viral particles you get in at one time. So the first thing I'd like to say is decrease your exposure. Decrease the contact time with people that are ill. If you have a look at what we call an aerosol, where people cough, and the distance the saliva and the mucus flies, which is very unpleasant, it's significant. So decrease your exposure to people that are coughing, and people that are coughing excessively should actually be wearing face masks, not the other way around, as we see in certain cultures, but not socially acceptable yet in our country. So avoiding contact, not staying indoors too long, making sure there's adequate airflow. It's very much our behavior in the winter that increases the rate of flu and colds. We stay indoors, we put the heaters on. Viruses live longer airborne if the air is dry and if the air is cold. So our close contact, our abnormal environment indoors, and lack of sunlight, which I'm going to get to in terms of vitamin D production in the skin, all increases our rate of infections. On that point, on exposure, I'd like to talk about washing your hands. We teach children to wash their hands to keep away infections, but we don't tell them to wash their hands after they've coughed into their hands, for instance. We don't teach them to wash their hands after they've touched public surfaces. One of the dirtiest things out there is a door handle knob. And a cold virus can survive 7 days on a clean, dry surface.
Oh my word.
It can only survive about 15 minutes. 15 minutes on a tissue. So a door handle has got more viral material on it than a tissue. So avoiding the contact to those surfaces is very important, and wash your hands. And the third factor is it's lifestyle and how you look after yourself. I'm
really surprised at the difference between the virus living on a flat surface and a dry surface and compared to a tissue. I mean, it's not something that I would have expected. I would have thought it's the other way around. And also when you are sick, you need to wash your hands 100 times a day, really.
Absolutely.
Because you're constantly busy coughing and wiping your nose, so it makes it very difficult.
Definitely, and if you have children around you, you work with children even more so.
Yeah.
There's a term for children. They are very much reservoirs of bacterial and viral infections. They get most of the infections and they share them.
Yeah.
The lifestyle factor, I often use the analogy of a car. If we had the ability to own a car that could somehow magically get stronger by giving it the right fuel and not putting sugar in the petrol tank, for instance, and it lived longer, needed less services and performed better, we'd give it the right fuel. Yeah. And we need to do that with our bodies, especially in the winter. We tend to go for the carbohydrate-rich, non-nutritive foods and not drink enough water. So you need to get that right before taking any supplemental help. And that's my last point here. How do we avoid? There are different levels of avoiding illness. There's the nutritive angle, eating healthy. Then there's some vitamins and minerals like vitamin C, additional vitamin D, and vitamin A, especially the beta-carotenes, which you'll all get out of fresh fruits and vegetables if you eat them. If you don't, take a supplement.
Yeah.
To bring in a different level of protection, I'd like to talk about a product called oscillocosinem, French product. It's been on the market over 80 years, and very much decreases the severity and delays the onset of flu, most flu viruses.
Yeah.
So taking oscillocosinem, I recommend to my patients to just take, even if it's half a vial, they come in small vials with pullules, tiny little sugar balls in them, and taking a dose once a week just to build your body up, to prepare it for the infection, so that when it hits, it's not as bad.
So does that also assist your immune system when you do that?
It does. It doesn't create a measurable change in the immune system function. We can't measure it or see it, but your immune system responds better. It adapts to the viral attack much quicker and attacks back much quicker, decreasing your symptoms.
Yeah. And something like vitamin D, for instance, you just go out and enjoy a beautiful day, even in winter. I mean, we're very lucky here that we have some sunny days.
Absolutely. 10 to 15 minutes a day in sunlight, 30% body exposure. You need parts of your body, your arms open. 10 to 15 minutes is all you need. But studies are showing that most people are vitamin D deficient these days, even in countries with beautiful sunlight like ours.
Yeah.
And it's about what you do during the day. If you sit in an office all day for 5 days a week, you're going to need a vitamin D supplement during the winter months.
Unless, of course, you take a walk during lunchtime. And if you're lucky enough to live in Hartenbos, then you can take your lunchtime here on the beach.
Be on a walk every day if I lived out here.
Amazing. So na daardie mond vol het jy nou tyd nodig om dit alles te absorbeer. So 'n stukkie musiek van Lucas de Beer, Ek verdien dit nie, en dan gesels ons met Dr Leon Strauss, 'n homeopaat, oor natuurlike remedies vir verkoue en griep. Lucas de Beer, Ek verdien dit nie. Baie jammer vir homself vanoggend, 28 minute na 10, dis Woensdag 3 Julie. Ons gesels met Dr Leon Strauss, hy's 'n homeopaat en ons praat oor verkoues en griep. So Leon, which natural medicines would you recommend for colds and flu?
When it comes to cold and flu, there's a long list of natural medicines you can take. There's a lot of folklore and tradition around how we treat these conditions, and the fact is most people with a cold get better spontaneously. So treating it is a question mark as to how ill you get when you get a cold. So if you tend to get a cold and it progresses to other symptoms, there's a lovely product called Corizalia. It is a homeopathic product, which means it's low dose, and taking it frequently makes the difference. It doesn't help taking 3 tablets in the morning and 3 at night. We want you taking 1 tablet every hour for the duration of the day. And Corizalia will cover symptoms like sneezing and irritation in the eyes and a sore throat, very much a hay fever picture as well, which we see a lot of down here, especially when this berg wind blows over the whole area. Nice to keep with you and take at the early onset to try and help those symptoms, almost like a natural antihistamine. When it comes to flu, when the flu hits and you feel it in your bones, oscillocosinem comes in again. Yeah, you take it more frequently, up to every hour for the first day until you start feeling better, and then you can decrease the repetition down to 2 hourly and down to 3 hourly until you clear, until the flu symptoms are gone. And if you do develop a cough, the product I frequently recommend is Stodol. It's available in most pharmacies and health shops. Stodol can also be used as a prevention, which I didn't mention earlier, especially in your highly compromised groups, the elderly and in children. Stodol has a lovely taste. It's a big plus, especially with kids, and it also helps to open the airways up a bit and help breathing, and has some ingredients that helps with sinus infections. So I recommend it with children just once a day as prevention. As soon as they start coughing, you can give it frequently. The 3 products I've mentioned now are safe to take with other medication. They're safe in babies. They're safe in elderly age groups. They're not going to cause any adverse reactions, which is a major factor when it comes to cold and flu medication today. I also work a lot with the herbal medication, and I'd like to list 2 here. Sambucus, elderberry, particularly black sambucus, is lovely as an antiviral product to take as soon as you develop the symptoms, but it also works to clear up the sinuses. It thins the mucus out in the sinus membranes. And additionally, echinacea, which I think most people are aware of today. Echinacea has a wonderful effect on priming the immune system, making it more tolerant to not overreact when you pick up an infection. So you don't get too much of a fever or too much of a sore throat, and the body heals a lot quicker after that. So it's the homeopathic products, Stodol, Corizalia and Oslocosinum. Very nice to use them specifically for the symptoms, and you can pick up the treatment a bit if it starts getting worse with elderberry and sambucus. And then your preventative medicine like vitamin C, also good to take higher amounts when you're getting ill, up to 3,000 milligrams a day. We talk about gut tolerance with vitamin C. As soon as you get a runny tummy from the vitamin C, you've taken too much.
Too much.
Just a little bit under that.
But I think you can take 1,000 milligrams a day normally, and up to 3,000 you said now for additional support?
Absolutely. You can go higher if you tolerate it, but you take the vitamin C in divided doses. So 1,000 milligram tablet 3 times a day. Some people need a bit more, some people can't tolerate it. So it's very much, you need to identify what the best dosage is for you. The vitamin D as well, up to 5,000 international units when you're ill a day, helps to decrease the viral effect. And of course zinc. Zinc is lovely to take in high dose to treat viral infections, and it also helps to increase the healing time of your mucous membranes, your inside skin, helping it to regenerate and become healthier after infection. So lovely to combine the herbal, the nutritive, and the homeopathic approach at once to try and alleviate flus and colds as quickly as possible.
But if I understand you correctly, it's better not to neglect it. You know, when you realize something's coming, you need to do something.
Absolutely. I come back to the same analogy of this wonderful car that performs better if you give it healthy petrol. If we hear something knocking in the car, we hear something grinding, and we're driving on the open road, we get it seen to because we know something very bad can happen. And same with the human body. We shouldn't ignore symptoms. We need to take a break, rest, listen, and address it as soon as possible.
Okay, so if you're nice to your car, you need to be nicer to yourself. So, Leon, thank you very much. I think we're ready for the rest of winter now. Would you like to just give your contact details if people want to be in touch?
Certainly. You can find me on Google under Leon Strauss, or contact the practice on 044 873 3345. And that is in George, or you can Google me. I should come up.
Dit was dan ons gesprek oor winterkoues en griep. Ek hoop jy het dit alles gehoor. En ons gaan nou afskeid neem van Dr Leon Strauss, handelsbreek neem, en dan is dit Joreen Rich se beurt met Sal jy.
90.1 104.1 SFM